Sandra Cole, a former patient of Dr. Esther Park, stands outside the clinic with a sign. Public health officials are warning around 2,500 people may have been exposed to bloodborne infections at the office, citing issues with cleaning medical tools. Her goal, to warn patients and demand accountability.
We need to start exposing these doctors, and we need to start exposing the College of Physicians and Surgeons' lack of accountability once and for all. It shouldn't take hundreds and thousands of complaints before something happens. It should be one complaint should be good enough.
That sentiment is shared by Rachel Malanta, who filed a complaint about Park to the College of Physicians and Surgeons of Ontario in 2021.
When the doctor came in, she stood in the doorway, did not close the door. We couldn't have been more than, say, 20 feet away from the lobby, the waiting room where people were. She started asking extremely personal questions. She said to get undressed, and I asked for some sort of covering, whether she had a sheet or anything of that description, a gown. She said, no, I should have brought it from home.
Malanta said after the doctor left the room, she closed the door herself and covered herself with her own tights.
The issue I was there for was purely external. So at no point did I consent to any form of internal assessment. And I'd also explicitly said that I was not there for a pap smear. She went between my legs, put her laptop to the side, and the next thing I felt, with absolutely not a word, I felt something get put inside me. I jumped up in pain because this hurt a lot.
Malanta says she was given a prescription and no further information. She says she was bleeding for days afterward. After a tearful call to her mom, she says she put everything in writing and filed an official complaint. She was unsatisfied with the response, which included Park refuting most of her claims.
Calling it a slap on the wrist would be an exaggeration. It was nothing. It was basically saying we recommend she does a communications course. I just wrote a long Google review hoping other people considering seeing her would read it, and left. I told everyone who would stand still long enough to listen.
The College of Physicians and Surgeons of Ontario says it's investigating Dr. Park in relation to infection control issues in her practice. CBC News requested an interview with the college, but they declined. We also asked for the number of complaints filed against the doctor, and the college said they couldn't provide that information, citing confidentiality restrictions. Dr. Park's license is currently listed as restricted on the college's website. This medical malpractice lawyer says if a patient is not satisfied with a CPSO decision, there's also the legal route.
So if a patient feels that the complaint process hasn't gotten them the resolution they were hoping for or the closure they want, a lawsuit can be sometimes a better option because it is more focused on ensuring that there's the recovery for the plaintiff themselves for the specific damage they suffered, as opposed to discipline to the physician that won't necessarily amount to anything for the patient. As long as everyone gets tested, and then if they do have questions about their rights, they should seek legal opinion as soon as possible and just make sure that they're aware of their options and they avoid any issues with limitation periods.
Toronto Public Health says the office corrected the infection control issues, but for patients like Malanta, her experience with the doctor has stayed with her.
It was, without question, the most traumatic experience I've had with any medical professional, possibly anyone at all.
CBC News contacted the clinic, and a staff member said Dr. Park will not be providing a comment. The office's answering machine states the doctor is retiring and the clinic will be closing in April. Talia, Ricci, CBC News, Toronto.